Hello, my name is Johannes Stray. I am delighted to introduce you to our new product, the VistaPano S 2.0, successor to VistaPano S. During the development process, it was very important to us to preserve everything that was good and tried and tested about the existing product, and to enhance it with new and useful features, along with improved ergonomics and a modern design. Special attention was paid to exceptional image quality and ease of operation. Among other things, S-Pan technology is used to achieve this impressive image quality and a very short exposure time of just 7 seconds for a panoramic image in an adult or 6 seconds for a child. Good positioning is absolutely essential for high-quality imaging. And this is why VistaPano S projects 3 clearly visible positioning lines onto the patient's head. The median sagittal plane, Frankfurt horizontal plane, and upper canine positioning beam. A modern design largely in white with black accents. An individually adjustable ambient light offer eye-catching appeal and set the scene perfectly for every dental practice. The large 8-inch glass color touchscreen optimizes the day-to-day working process. All settings for image acquisition can be set up directly on the device. This avoids walking distances and reduces the time the patient spends in the device. VistaPano S 2.0 is available in 2 variants. Firstly as a panoramic X-ray unit, and secondly as a cephalometric unit for orthodontic applications. Here, the Ceph module sets completely new standards. Thanks to its high speed, lateral images are generated in less than 2 seconds. With the completely covered Ceph sensor and the absence of a secondary collimator, positioning is significantly simplified, and patient contact with moving parts is eliminated. With its very compact footprint, the VistaPano S 2.0 will fit even in small X-ray rooms. Face-to-face positioning with direct eye contact is comfortable and easy for the operator and the patient. The head supports open and close electronically at the push of a button. All positioning aids required for positioning are included in the scope of delivery. The new Comfort Bite Block is suitable for dentate patients, thanks to its even more stable positioning. With the dental crowns fixed in the comfort foam, its advantages really come into play for patients who are fully or partially edentulous, with separation of the upper and lower jaws and precise, comfortable positioning. Additionally included are an autoclavable bite block, a chin support for edentulous patients, a holder for temporomandibular joint images or sinus images. Thanks to the S-Pan technology and a modern CSI sensor, VistaPano S 2.0 produces images that are exceptionally rich in detail, and this with a low radiation dose and short exposure duration. Here, the S-Pan technology maps 20 layers per rotation, which it then combines into a pinpoint-sharp panoramic image. When the S-Pan technology is paired with the metal artifact reduction feature, excellent X-ray images can be produced even with implants and restorations. With a total of 17 different X-ray programs to choose from, you can always generate the right X-ray image for any diagnostic requirement. In addition to standard panoramic images, these include, for example, half-side images, 4 programs for children with a smaller exposure area and significantly reduced radiation dose, 5 special programs for orthogonal images, including various bite joint variants, 2 programs for temporomandibular joint images, and 2 programs for sinus images to display paranasal sinuses. In addition, a stable carpus plate also comes as standard with VistaPano S 2.0. As well as standard lateral images, it is also possible to take full lateral images, head PA, AP, SMV, Waters view, and carpus images. A height adjustment integrated into the SEF housing enables ergonomic positioning. The delivery content of the VistaPano S 2.0 also includes the imaging software VistaSoft. VistaSoft is very easy and intuitive to use and offers a wide range of functions. With the implant visualization function, implants from different manufacturers can simply be placed by drag and drop. VistaSoft can be linked to all standard practice management software tools, which means that the details of the patient can be automatically copied across. VistaSoft Cloud Exchange is available for fast data exchange with patients, colleagues, or laboratories. This optional feature is compliant with GDPR and the quickest and easiest way to share dental images. Even if the dental practice does not yet have its own CBCT device, three-dimensional imaging is an essential part of modern dental imaging. This is why VistaSoft already comes with a 3D license as standard. This enables the practice to save 3D image data for diagnosis and treatment planning purposes. With VistaPano S 2.0 or VistaPano SF 2.0, you have a panoramic X-ray device that is incredibly easy to operate and offers exceptional image quality. Or VistaPano SF 2.0. It takes just 7 seconds to take a panoramic image, or less than 2 seconds for a SEF image, making it one of the fastest devices on the market. The combination of VistaPano S 2.0 with VistaSoft is a complete solution for extraoral 2D imaging in dental practices.